Hi, my name is Parth,
My name is Vivian.
and today we're going to be talking about clinical centrifuges.
Clinical centrifuges are basically a type of laboratory equipment used to separate liquids and solids by spinning a sample at high speed. Some examples include blood, lipoproteins, cellular components, DNA fragments, and sediment from urine. It is mainly used for clinical trials and laboratory testing, but can be used in the medical field, such as biomedical research. The main thing that clinical centrifuges are known for is to separate blood. This is where we find that clinical centrifuges have a huge impact on people in our society. How, you may ask? Well, every day there are a ton of people getting injured, and some of them require the need for blood. So, when you donate your blood to the blood banks, it is then sent to the lab to be separated in a clinical centrifuge. Once the blood is separated into its components, it can be tested for infections, diseases, and the blood type. After the lab technicians give it a go, the red and white blood cells, plasma, and platelets are then sent to hospitals where they're stored until it's needed. By having a clinical centrifuge separate the components of blood, doctors are able to make a diagnosis, which is how about 70% of medical decisions are made. Doctors would then know how to follow through with the treatment to help the patient get better. If they're looking at red blood cells, they can detect diabetes, anemia, iron deficiency, and parasites. But if they're observing the white blood cells, doctors can determine if the patient has leukemia, cancer, or malaria. However, if they study the platelets, they can identify any of the conditions involving the bone marrow, such as leukemia and cancer, as well as autoimmune diseases by looking at the platelet count. Generally, clinical centrifuges allow us to assess the general state of our health by confirming bacterial or viral infections, cholesterol levels, screening genetic conditions such as cystic fibrosis and spinal muscular dystrophy, as well as HIV or any sexually transmitted disease. It even allows us to determine if we have pancreatitis or pneumonia. There are many other things that clinical centrifuges detect, but those are some examples. Now that you know how much of an impact clinical centrifuges have on our society, you might be wondering how it's related to forces in circular motion.
Alright, so let's talk about a little bit of background information before we get into medical centrifuges. When there are particles suspended within a liquid, eventually if the solution is kept still, the particles will eventually settle to the bottom of the solution. This process is called sedimentation. But what happens when the particles are extremely light? It would take days or weeks for these particles to settle to the bottom. So through a process called centrifugation, we can speed up the separation of particles from a solution very quickly, drastically reducing the time required to separate the substances from days to minutes. Centrifugation is a process of separating two different substances of different densities from a mixture with the help of a centrifuge. So how does a centrifuge work? Basically, through high rotational velocity, a substance is forced to the outside, just like when you feel like you're going to fly out of the car when you take a really sharp turn at a really high speed. In the same manner, blood cells, platelets, and other contents of blood are forced to the outside, separating it from the plasma that they flow in. The greater the density of the substance within the blood, for example the blood cells, they will be the first to pool at the bottom of the test tube, followed by the rest of the substances following in decreasing density. Okay, so let's talk about some of the advantages and disadvantages about centrifuges and their other real-life applications. The biggest disadvantage to the medical field from centrifuges is that although you can reduce the time it takes to separate blood components, spinning blood at a very high rate or at a very high velocity will actually lead to the destruction of blood components. There must be a balance at which you can maximize the efficiency of a centrifuge with the least amount of time, but also preserve the blood. Disadvantage is very important when it comes to human centrifuges. Have you ever wondered what it feels like when a fighter jet takes a really sharp turn? Flying at high speeds and taking sharp turns in the air creates a phenomenon known as g-forces. G-force is simply the inertial force exerted upon an object when it changes direction traveling at a very high speed. The sharper the turn, the greater the g-force. When pilots are in training, they are required to help their bodies withstand or resist g-forces when they are in flight. If they do not do this, the blood in their bodies will be pushed into their head or straight into their feet, causing them to pass out. To counter this, they must train their bodies to withstand g-forces by taking repeated procedures within a super large centrifuge. Here, they are physically trained to withstand the effects of g-forces on their bodies. Although this training is very helpful, it may still not be enough to withstand the extreme g-forces. But through understanding centripetal forces, scientists and physicists were able to develop a G-suit, which pressurizes the body and helps keep blood to the top part of the body, and prevents blackouts when pilots are in flight. These are just a few applications that we've developed through the use of circular motion and centrifugal force, out of the many. With it comes many advantages and disadvantages. I hope you learned something about centrifuges that has helped change the world and have some new insight on the physics around us.
Created using PowToon.